General urologists diagnose and treat all conditions. The benefit of being part of Chesapeake Urology is as a general urologist, we're allowed to treat all conditions, but if something seems too difficult for us, I have a large panel of the specialists, subspecialists in urology that I can refer patients to. So we will treat everything from erectile dysfunction, whether it's pills, injections, or implants. We will treat bladder cancer. If a patient has small little tumors, we can do the surgery to remove those tumors, to give the immunotherapy or even the intravesical chemotherapy. We will treat low testosterone. We diagnose it, and it's either injections, pills, or gels. We treat kidney stones. So most kidney stones can be either passed on their own, or you can do a shockwave treatment for them, or you can use a scope to go and retrieve the stone. And we have subspecialists if it requires a larger surgery for larger stones that are very easily accessible to us. We treat all urinary conditions, whether a patient urinates too often, too frequently, it burns too much, they're unable to urinate. We're able to treat all those conditions that have various different causes of why it happens. We treat many different types of cancers. Prostate cancer can be treated either with medication if it's metastatic, surgery, or radiation therapy. As a general urologist, you may not necessarily be doing the radiation or the surgery, but you help guide the pathway for the patient. For testicular cancer, we're not the ones that do the chemotherapy if it's needed, but doing the surgery to remove the cancer, we do that as general urologists. Many different conditions. In Chesapeake Urology, patients can either see a urologist by being referred from their primary care doctor, or they can self-refer. If a patient, for example, wants a vasectomy, it's often urologists that perform those procedures. If a patient has urinary difficulties, blood in the urine, burning urination, difficulty urinating, they may have to see a urologist as well. If a patient wants to be screened on a regular basis, prostate cancer, or if they have a family history of kidney cancer, they may need to see a urologist. We basically are able to treat all those various conditions and to work up those conditions. Oftentimes it may not be something severe, but we need to make sure that nothing wrong is happening. If a young man has a testicular mass that is slowly growing, they may want to see a urologist. Oftentimes that mass is not testicular cancer. It could be a cyst that's outside the testicle, and that's not a big deal at all. But if it feels like it's part of the testicle, it may need to be treated and evaluated, for example, with an ultrasound or with doing a CT scan or tumor markers. But they should go sooner rather than later to see a urologist. So if a patient has blood in the urine with no known cause, urinary tract infections, injury to the kidney such as a car accident, but they just see blood in the urine, and then the blood stops, they should still see a urologist. We call that a sentinel bleed. If there's a bladder cancer in the patient or a kidney cancer, they can oftentimes bleed very easily. That may be a telltale sign something is wrong. Now, it's only about 20% of the time that we find something, but if you're in that 20%, you'd rather know sooner than later.